Matthew Holt, another THCB Quick Bite. I'm here with Sylvana Sinha. She is the CEO of Praava. Did I get that right? I got it.
Yes.
Good. Okay, right. I was going to confuse you with Praava because you're not a million miles away from them. But anyway, your company, Sylvana, is a integrated medical clinic based in Bangladesh, which is a little unusual. But here at Frontiers Health, all the Italians outside the healthcare conference smoking around their mouths, so we're here catching a moment. So tell me, first off, you were educated in America. Why did you go to Bangladesh to start a company?
Yeah, so actually I was born and raised in the United States and lived and worked mostly in New York City. Also spent some time working in U.S. foreign policy abroad. But my family's originally from Bangladesh, and I was visiting for a family wedding when my mom actually was hospitalized, and it was just a very eye-opening experience. And I'd always worked in emerging and frontier markets and knew that Bangladesh had grown dramatically really during my lifetime, population of 170 million people, one of the fastest growing economies in the world, a middle class of 40 million people. And when I had this experience, I observed that despite all of this progress, no amount of money could afford you access to high quality healthcare. So as a result, every day you have thousands of Bangladeshis, and every year billions of dollars leaving the country to access high quality healthcare abroad. And that just struck me as an opportunity. And so I kind of became obsessed with solving that problem.
So before we go on to what you're actually doing, I mean, probably the world image of Bangladesh is not of a fast growing emerging economy. It's struggles and floods, all the bad stuff we hear about. But we've always heard a lot about the Indian emerging middle class. Tell me a bit about the sort of the economic buying power and what's the GDP and how is Bangladesh doing?
Yeah, Bangladesh is doing great. It's $300 billion economy. The GDP per capita has actually exceeded India's 3 years in a row now.
Oh, wow.
And so I actually think, we have this very dense population as well, 3 times the population density of India. No one's more than 5 hours away from a city, which is also very different than India. And it's also a homogeneous population by and large, 90% Muslim. Everyone speaks the same language. So the IMF chief economist actually describes this as the density dividend. So if you can build a business in the capital city, it becomes much easier to scale it across the 170 million people in the country.
That's fascinating. So let's talk about your business.
Yes.
So what does Praava do?
So Praava is an integrated outpatient care model, a one-stop shop for all of your outpatient care needs. So primary care, secondary care, we do all the lab and imaging diagnostics in-house, as well as in-house pharmacy. And we have integrated technology at every layer of the Praava experience. We brought Bangladesh's first fully integrated hospital information system, as well as the first patient app in the country. So really, high quality, both in-clinic and remote and virtual healthcare experiences at an affordable price point. We've been around for 4.5 years, and we've served more than 400,000 patients to date.
Well, that's not bad at all. So, and how much of this is in person, and how much are you using telehealth and other tools, and how is that going, and how's that hybrid model going?
So that's a great question. So we rolled out telemedicine at the start of the pandemic. We were the first private provider to partner with the government on their free telemedicine hotline. And so it's hard to say, to be honest with you, at steady state what it will look like. It's ebbed and flowed. During surges, 90% of visits were coming in through virtual channels. Now it's almost the opposite, right? Between 10 and 15% of visits are virtual. But we have a new version of our app coming out, actually, which will make it even easier to access the telemedicine piece. But we are more or less the largest telemedicine provider in Bangladesh right now.
Wow. So, but you're predominantly a bricks and mortar clinic. On that scale, how do people access you and how people pay for you? So, yeah. I mean, I must admit to not be a great expert on the Bangladesh health insurance system, if there is one, or the government system. So, what does a typical Bangladeshi do? How much? Will they come to you? Do they pay a subscription? Do they pay a fee for service? How much does it cost? Tell me about how that works.
It's a great question. So, unfortunately, only 1% of the population has health insurance, and that's all pretty much hospital and catastrophic care.
Yeah.
So it's really an out-of-pocket expenditure business. 72% of health spending in Bangladesh is coming from out-of-pocket spending. So our business is, to be honest, by and large a cash business. 20% of our revenues come from corporate clients who are paying for the cost of care for their employees. We do have a membership model whereby you pay a flat rate for unlimited access to services, which is our bet on value-based care for the region. It's a new product for the market because there's no insurance, are not really used to prepaying for healthcare.
Yep.
But we believe that's going to pick up over time, and we find, particularly for chronic disease sufferers, that they see a lot of value in those membership plans.
All right. So, typically they're coming and taking fee for service. What does it? If I walk in and get a primary care exam or a lab test or whatever, what am I paying?
So the average cost of a visit to Praava is around $25. To see a doctor alone is about $10. And then if you add on the labs and the drugs.
And if I was going somewhere, what would my alternative be? Would
Yeah.
I go somewhere else? And what would a private doctor usually cost? Is it are you cheaper, more expensive? Are you branding out? What's your niche in the market?
It's a great question. To be honest with you, there aren't a huge range of options targeting the middle class segment of the population. There are some very expensive hospitals, and so to see a doctor there, even a regular GP, might be up to double what you're paying at Praava. It's also not free enough, the free care that you can access through the public system. So we like to say we're priced really at market,
right.
And offering more value for money at that price point.
So you mentioned earlier you had 400,000 patients have used the system. How many employees, doctors, clinics?
Yeah.
Give me a sort of the scale.
Yeah.
Where you are now compared to where you were 3 years ago.
Yeah. So we have about 400 employees, mostly front-facing medical staff, medical professionals. We have one flagship center, which is a 10-story building in downtown Dhaka, and we have collection points all over the country, mostly in Dhaka, but that's kind of the Quest Diagnostic side of the business, the reference lab side of the business. We're raising $15 million to scale the business. We'd like to build out more centers. It's a hub and spoke model, so the hub is the 10-story building. The spokes would look more like a one medical or a primary care physician's office, 3,000 to 5,000 square feet. You can see a doctor, you can draw blood, do a basic x-ray, buy some drugs, but for anything more advanced, you get sent to the hub, and your labs get sent to the hub for analysis.
Right. And on that part, I mean, you sound to me a little bit like, and this is kind of dating medical history. Back in the 1930s, there was a guy called Sidney Garfield who invented a system like that, which became Kaiser Permanente. Mm-hmm. It's basically an outpatient-based system, which eventually started adding hospitals and inpatient. Is that the route you're going to have to go down, or where do you think?
I think, in order to really prove our value-based care model, we do need to eventually have a hospital, but in my view, one of the big challenges in healthcare in Asia is care is overly hospital-centric. I mean, we complain about that problem in the United States. It's much, much worse in emerging markets than in Asia. And so the fact that we have a 10-story building that's an outpatient center is in and of itself, to be honest, somewhat innovative. So I really want to mainstream that concept of outpatient care and keeping people out of the hospital instead of driving them into it. But there is a dramatic need. I mean, the sky's the limit in terms of the opportunity in healthcare in Bangladesh. Less than 10% of the market is dominated by big players, and that has been our major opportunity. We're a household name in Dhaka, which is one of the, it's a 40 million strong population, one of the biggest cities in the world. And we've done that, partly because we have a great team and we're great, but equally because there's very little competition in the market. And so that is the opportunity, and I think with the brand value we have, certainly a hospital could be in the future, but in the near term, I'm really focused on building out the outpatient centers.
All right, so you're raising, how much you raised so far, and what's the current sort of the current ask in the market?
Yes, so we've raised more than $13 million to date, primarily from angel investors. We have an amazing team of investors, but we are looking for a lead for a $15 million round.
Okay, and so assuming that arrives, and this market's a bit tricky, and Bangladesh is not a place that the average sort of Silicon Valley bro investor dude probably knows where it can find on the map, let alone find out. So there's some education required there for sure, I guess. But what do you think Praava looks like in 5 years' time?
In 5 years, we believe we will have served more than 5 million patients, and we should be at more than $200 million in revenues.
That's very exciting.
The business starts generating quite a bit of cash after 3 years, so after the $15 million raise, we actually don't have to raise again. So we can self-finance expansion.
That's very exciting. So essentially, you almost have a greenfield set opportunity to build something really
exactly.
big.
We have the opportunity to build a healthcare system from scratch, and it's really exciting. I mean,
and in a pretty damn big country that that's about 170 million people, probably growing quite fast. So fantastic.
No, it's very exciting. Come visit. We'd love to have you.
All right. Well, we will look for the next time. So it's an open invitation to anybody watching this to go to Bangladesh.
Absolutely. Find me on LinkedIn.
All right. You'll find Sylvana Sinha. Sorry, name me your name. She's the CEO of Praava Health from Bangladesh, and good luck with the race.
Thank you.